Hi, I'm Jocelyn, and this is my daily patient reassessment video. Before entering the patient's room, I'd look at the electronic health record, I would look at lab values, any existing orders, and if there's any new orders. And then when you look at the door, you would see if there's any isolation precautions, and if there is, you would look at like the PPE that you would need. And since there are none, I'm going to enter the patient's room. Hi.
Hi.
I'm Jocelyn, and I'm going to be your nurse today.
Okay.
Can you confirm your name and date of birth?
Kylie, 6606.
And then I'm going to check your armband, and everything matches. What brought you in today, Kylie?
I'm just having some stomach pain.
Okay. And is there anything that makes your pain worse or better?
No, not really.
I'm sorry about that. Can you tell me what your pain kind of feels like?
It feels kind of like a dull stabbing pain.
Okay. And where would you say this pain is located?
Kind of more on top of my stomach.
Okay. And what would you say your pain is on this scale?
An 8.
An 8. I'm sorry about that. And when did this first occur?
Around 2 days ago.
Okay. So it's been going on for a couple days then. Next, I would assess my patient's consciousness. I'm going to start by asking her a few questions. Kylie, do you remember my name?
Jocelyn.
Where are we right now?
The nursing Simmons Center lab.
And do you know the date today?
July 14, 2025.
Okay, and my patient is fully alert and conscious, so we will not be performing the Glasgow Coma Scale. Next, I'm going to assess her pupils. Okay, I would say her size is a 5 on this eye, and also a 5 on this eye. And next, I'm gonna test her pupillary light constriction. On both eyes, there was consensual constriction when light was shown. And next, I'm gonna look at her alignment and posture. Her posture is adequate. She has no facial drooping. Her facial expression is happy and present. And do you have any difficulty swallowing, Kylie?
No.
Next, I'm going to assess her skin temperature. Not temperature, I'm going to assess what her skin kind of looks like. I would say it's tan with pink undertones, and there is no sweating. I'm not noticing any odors, and her hygiene seems adequate. And next, I'm going to test muscle strength. So, okay, Kylie, I'm actually going to start up here. Can you squeeze my fingers, please? Okay, can you hold your arms like this? Can you pull against me or pull towards me? And then pull against me. Okay. And then next we're gonna test for on her feet. Okay. Can you push against my hands? And then pull towards me. Okay. And then can you lift your legs, please? And then lastly, can you wiggle your fingers and toes? Was there any numbness or tingling?
No.
Okay. And next we are going to do vitals. First I'm going to take temperature using the temporal temperature probe. Okay. 97.9, her temperature is normal. And now we're going to do her apical pulse. And I will do that. Can you lift your shirt up for me, Kylie? Yes, thank you. And then Okay. Your apical pulse was 68 and your respirations were 16, so everything was normal there. And next I am going to do an estimated systolic blood pressure. Can you put your arm out for me? And I would measure the cuff, and it looks like this is within the right range, so we will be using an adult size cuff. Perfect. And can you hold this for me? Thank you. Okay. Right. Wrong way. Okay, so I stopped feeling your brachial pulse at about 110, so I will inflate the cuff to 140 when we do blood pressure in a moment. Okay. Oops. Next, I'm going to take your pulse oximetry. Can you put your finger out for me? And just lay that flat on your leg. You have 98, which is normal. Okay, and now we're gonna do your blood pressure again. So can you hold your arm out for me? Thank you. There we go. And can you hold this again? Okay. Okay, I got about 110/60, which is normal. And then next we're going to go into a lung assessment. If she had a nasal cannula or anything, we would assess that, make sure it's fitting properly and that the flow rate was correct. Do you have any coughs? Do you have a cough right now or anything?
No.
Have you noticed any mucus recently?
No.
Okay, and then can I have you lie on the edge of the bed to make it easier to listen to the lungs? And while I auscultate the lungs, I will do 6 points on the front, 6 on the back, and 2 at the sides. Okay, can you take deep breaths for me?
Mm-hmm.
And then can you lift your sides up for me? Thank you. Okay, her lung sounds were normal. I did not notice any crackle or wheezing. And when you auscultate, you would not auscultate over clothes, but since we don't really have the means to not be able to do that right now. And next I'm going to listen to her heart. I'm going to listen in different spots, starting with the aortic, and then I go to the pulmonic, Erb's point, tricuspid, then mitral. Now I'm going to listen with the diaphragm, or the bell. For her heart, I did not notice any extra sounds. S1 was heard louder at the apex, and S2 was heard loudest at the base. Next, we are going to move into a circulatory assessment. I'm going to assess for any swelling. So first, I'm just going to kind of go like this. Okay, there's no swelling after assessing for that, and I'm going to check her capillary refill. First, I'm going to do so on her toes. Less than 3 seconds. Less than 3 seconds. Fingers. Less than 3 seconds. And less than 3 seconds. I would also be looking at the IV site and look at the flow rate, make sure everything's like properly installed and that there's no issues with that, and she does not have an IV, so we are not going to be assessing that today. And now I'm going to check her pulses. First I'm going to do the pedis pulse. That is 2+. Next we're going to do her tibial. Also 2+. And lastly, I'm going to do, can you hold your arms out for me? I'm going to do her radial pulse. That is also 2+. Next, we are going to assess skin. Her skin still appears, if there was anything with DVT, any prevention devices, I would make sure that those are properly installed, working properly. Now we're going to assess skin. Her skin is still tan and pink. I'm not noticing any cyanosis or anything like that. She has no lesions, nothing like that. If she did have a lesion or an ulcer or something, we would perform the Braden scale to assess for breakdown. Her skin feels warm, no coolness or anything. If she was, like if she had a pressure injury or something like that, we would maybe possibly be looking at implementing like a turning schedule, but we do not have to do that today. And if there's any like breakdown devices that help with pressure injuries, we would also be making sure that's installed properly. And next we're going to move into abdominal. So can I have you move your shirt up for me? Are you having any pain in your stomach?
Just like right up here.
Okay.
Where it was.
I'll make sure to be cautious of that. And I'm going to start in the right lower quadrant and move clockwise. Okay. Is it okay if I move this down a little bit?
Mm-hmm.
Okay. There we go. bowel sounds were present in all 4 quadrants. And next we're going to palpate for any tenderness or masses or anything. I'm going to be cautious because she's having stomach pain. And you just tell me if there's any tenderness or if anything's hurting, okay?
Okay. This is a little sore up there.
Okay, I'll be extra cautious then. Okay, and I did not notice any masses or tenderness or anything. Kylie, do you have any nausea or vomiting right now?
No.
Okay, and then next we're gonna move into bowels. How often do you have a bowel sound?
Probably once a day.
Okay, or bowel movement, not sound. Can you tell me what your last stool looked like?
Type 4.
Okay, that is normal, that is good. What is your diet look like? Is it normal? Do you need any changes?
It's good right now.
Okay, that's good. How often are you urinating?
I would say, a few times a day.
Okay, and can you describe like the color and stuff?
Clear, light yellow.
Okay, that's normal, that's good. How much are you urinating?
Probably around a cup each time.
Okay. And then next we're gonna move into movement. Do you have any issues with walking or anything?
No.
Okay. Do you use any assistive devices?
No.
Okay. If we were assessing mobility and we suspected that there was some issues, we would be using a scale like the Morse scale, but we will not be doing that today. And lastly, I would ensure that the bed is lowered all the way, which we cannot do on this bed, and that everything's locked, that the lower side rails are down. And Kylie, do you need anything else while I'm in here today?
I don't think so.
Okay, thank you for being in my patient reassessment video. And then before leaving, I would ensure that I performed hand hygiene